The ReSure Sealant is an in situ formed hydrogel that creates a temporary, soft, and lubricious sealant to prevent fluid egress following cataract or intraocular lens placement. Note: a sterile technique should be used at all times during preparation and application of the ReSure Sealant. The ReSure Sealant comes with 2 applicators, a diluent dropper, and a mixing tray found within the foil pouch. The mixing tray contains 2 channeled wells. Each well has a white deposit containing polyethylene glycol and a blue deposit containing trilysine acetate. The diluent dropper is found in the exterior pocket of the foil pouch. The 2 applicators are also found in the exterior pocket of the foil pouch. Preparing the ocular surface. Ensure the incision is not actively leaking. Stromal hydration may be used to stop an active leak. Remove any standing moisture from the incision and surrounding tissue to ensure the application site is dry. The application site should be dry with a minimum radius of 5 mm around the incision. Note: use as many surgical sponges as necessary to thoroughly dry the incision and surrounding tissue. Preparing the tray. Remove the end cap from the diluent dropper and keep cap. Select 1 channeled well for mixing and add 2 drops of diluent to the blue deposit. Note: do not add any drops to the white deposit in the same channeled well. Use the applicator to thoroughly and rapidly mix the solutions using a back and forth motion for up to 5 seconds. Note: material must be applied within 12 seconds after mixing is initiated or gelation will occur. Dip the foam tip of the applicator into the solution to collect an adequate amount of material to cover the incision. Caution: each applicator is intended for single use only. If a second application is required, use the second applicator. Applying the ReSure Sealant. Apply the ReSure Sealant over the incision, ensuring full coverage with good margins. Achieving full coverage. If full coverage is not obtained with one application, use the second channeled well for an additional application. Note: if a second application is necessary, apply material only to the area that needs coverage. Adding thickness does not increase the effectiveness of the sealant. Remove applicator prior to gelation. Stop manipulation of the applicator if material stranding is observed. If application was not completed prior to stranding, prepare the second channeled well and reapply. Hydrogel polymerization. Delay irrigation or introduction of any post-surgical medications for at least 30 seconds after application of the ReSure Sealant. The ReSure Hydrogel will remain on the ocular surface until reepithelialization occurs or up to 7 days after application. Selective adherence. The ReSure Sealant selectively adheres to deepithelialized tissue. Device removal. The ReSure Sealant may be removed carefully with forceps if necessary. Add 2 drops of diluent to the blue deposit. Rapidly mix the components for up to 5 seconds. Apply the hydrogel within 12 seconds after mixing is initiated. thoroughly dry the incision and surrounding tissue. Apply the ReSure sealant over the incision, ensuring full coverage with good margins.